Depression isn't just a part of aging. It's a serious condition that can affect anyone, including our seniors. Yet, it often goes unnoticed, misdiagnosed, or mistaken for just getting older. Today on Health 999, let's talk honestly and gently about depression in the elderly. Because recognizing it is the first step toward healing. 1. Why are the elderly more prone to depression? As we grow older, our lives undergo major transitions. These changes, though natural, can be deeply emotional, and sometimes even overwhelming. For many older adults, these shifts create the perfect storm for depression to quietly take hold. One of the biggest factors is loss. The loss of a spouse, a close friend, or even a beloved pet can trigger profound grief. While grief is a normal response, when sadness lingers for weeks or months and affects daily functioning, it may develop into clinical depression. And because seniors may lose multiple loved ones over time, the emotional weight can be compounded. Then there's retirement. For many, work is more than just a paycheck. It's a sense of identity, a daily routine, a way to feel useful. Retirement, while freeing in some ways, can also feel like a loss of purpose. Without the structure of a job or the social interactions that come with it, loneliness can creep in, quietly but powerfully. Physical health is another major contributor. Chronic conditions like arthritis, diabetes, or heart disease don't just affect the body, they weigh heavily on the mind. Pain, reduced mobility, and medication side effects can lead to frustration, helplessness, and eventually, hopelessness. Studies have shown a clear link between chronic illness and depression in older adults. Isolation plays a significant role as well. As people age, their social circles tend to shrink. Children grow up and move away. Friends relocate or pass on. Mobility issues make getting out harder. Even transportation can become a barrier. Without regular human connection, a person may start to feel forgotten or invisible. Let's also talk about stigma. Many seniors grew up in a time when mental health wasn't discussed openly. They might see depression as a weakness or something to be ashamed of. As a result, they might avoid seeking help or even deny their own emotional pain. Instead of saying, "I'm feeling depressed," they might say, "I'm just tired," or "I don't feel like myself lately." That's why it's so important for loved ones and caregivers to pay close attention to subtle changes. And finally, cognitive decline and early-stage dementia can also contribute to depression. When memory begins to fade or confusion increases, many seniors become frightened or anxious. They may feel like they're losing control of their minds, their independence, and their lives. This emotional turmoil can easily spiral into depression if not addressed. In short, depression in the elderly is not caused by just one thing. It's often the result of multiple factors coming together: physical, emotional, social, and even spiritual. And because the symptoms can be mistaken for normal aging, depression is often overlooked or untreated. But here's what we must remember: depression is not a normal part of aging. It is a medical condition. And with the right care, compassion, and understanding, it can be treated, even reversed. 2. Warning signs to watch for. Depression in older adults often goes unrecognized, not because the signs aren't there, but because they can look so different from what we typically expect. It doesn't always show up as someone crying or saying they're sad. In fact, many seniors may not even use the word depressed. They may say things like, "I just feel tired all the time," or "nothing really matters anymore." So, what should we look for? First, there are emotional signs, like persistent sadness, hopelessness, or feelings of emptiness. An older adult might say they feel like a burden, or they may express guilt over things that aren't their fault. They may talk about life feeling meaningless, or say things like, "What's the point anymore?" Then there are behavioral changes. You might notice a senior who used to enjoy gardening, reading, or playing with the grandkids suddenly loses interest in these activities. They may stop going to church, cancel plans with friends, or withdraw from family gatherings. This loss of interest in things they once loved is a major red flag. Changes in sleep are another common sign. Some seniors may struggle to fall asleep or stay asleep. Others may sleep much more than usual, but still feel exhausted. Chronic fatigue, especially when it's not linked to a medical issue, can be a sign of depression. Another symptom to pay attention to is appetite and weight changes. Some elderly individuals might lose interest in eating altogether, while others may turn to food for comfort and gain weight rapidly. Sudden weight loss or gain, especially without a clear medical cause, should never be ignored. We also need to consider physical symptoms. Depression doesn't just affect the mind, it affects the body too. Seniors may complain of aches, pains, headaches, or digestive issues that don't seem to respond to treatment. These physical complaints are real, and they can often mask an underlying depression. Cognitive issues may also arise. An older adult with depression might seem forgetful, confused, or have trouble concentrating. In some cases, this can even be mistaken for dementia, which makes it even harder to diagnose correctly. And finally, one of the most serious warning signs is when a senior expresses thoughts about death. This doesn't always come in the form of saying, "I want to die." Sometimes it's more subtle. They might say things like, "Everyone would be better off without me," or "I don't want to be a burden." These statements should always be taken seriously, no matter how casually they are said. It's important to understand that these signs don't always appear all at once. Sometimes they creep in slowly, over weeks or even months. But if you notice a pattern, a decline in mood, energy, interest, and function, it may be time to gently ask, "How are you really feeling lately?" Recognizing these signs early can lead to hope, healing, and a much better quality of life. Because depression is not a normal part of aging, and every life, at every age, matters. 3. The impact of untreated depression in the elderly. When depression goes untreated in older adults, the consequences can reach far beyond sadness or emotional pain. It quietly spreads into every corner of a person's life, affecting not only the mind, but also the body, the heart, and relationships with loved ones. First, depression can intensify physical health problems. Seniors often already deal with chronic illnesses like heart disease, diabetes, arthritis, or high blood pressure. Depression can make these conditions worse by increasing inflammation, disrupting sleep, and lowering the motivation needed to manage medications or attend medical appointments. A person who is depressed may stop taking care of themselves properly, leading to faster physical decline. Second, untreated depression often leads to cognitive decline. It may look like memory loss, confusion, or difficulty concentrating, symptoms that can mimic dementia. In fact, some older adults are misdiagnosed with Alzheimer's or another form of dementia when, in reality, they are living with severe depression. The brain simply doesn't function at its best when weighed down by hopelessness. There is also a deep emotional toll. Seniors may begin to feel like a burden to their families. They may withdraw from social activities, stop engaging with friends or community, and lose interest in hobbies they once loved. This isolation creates a painful cycle. The more alone they feel, the deeper the depression becomes. It's a silent suffering, and it often happens behind closed doors. Depression can also take away sleep. Some seniors lie awake for hours, unable to rest. Others sleep too much, yet never feel refreshed. Lack of proper sleep weakens the immune system, raises the risk of falls, and contributes to daytime fatigue and confusion, all of which lower quality of life and increase the chance of hospitalization. In some of the saddest cases, untreated depression can lead to suicidal thoughts. Many people assume that suicide is more common among the young, but in reality, the elderly, particularly older men, have some of the highest suicide rates. Often, they don't speak openly about these feelings. They may quietly give away possessions, stop eating, or express thoughts like, "Everyone would be better off without me." And that's why untreated depression isn't just something to wait out or hope it goes away. It's not a phase, and it's not weakness. It's a serious medical condition that deserves serious attention. But here's the hope. With proper care, whether through therapy, medication, or support from family and community, even deep, long-lasting depression can begin to lift. Life can become brighter again. The earlier we notice the signs and start the conversation, the better the chance for recovery. So let's break the silence. Let's check in on our aging loved ones, not just to ask how they are, but to truly listen. Because what goes untreated today may become a tragedy tomorrow. But with love, care, and support, healing is possible. 4. Treatment and hope. The most important thing to know about depression, especially in older adults, is that it is treatable. No one is ever too old to feel better. Healing is not only possible, it's real, and it starts with understanding the options available. Treatment for depression in the elderly often takes a holistic approach, addressing not just the mind, but also the body, lifestyle, and relationships. Let's begin with psychotherapy. Also known as talk therapy, this allows seniors to speak with trained professionals who can help them explore their feelings, identify the roots of their sadness, and develop healthy coping strategies. Sometimes, simply having someone listen, truly listen, can be incredibly healing. Therapies like cognitive behavioral therapy, CBT, have shown great results, even in later life. Then there's medication. Antidepressants can be effective, but they must be used carefully, especially with older adults who may already be taking medications for other conditions. A qualified doctor or psychiatrist will evaluate the best options and monitor for side effects. The goal is to find balance, not to numb emotions, but to help lift the cloud of persistent sadness so that life feels manageable again. But therapy and medication aren't the only tools. Lifestyle changes can play a surprisingly powerful role in lifting mood and restoring a sense of joy. For instance, exercise, even something as simple as daily walks or gentle stretching, has been shown to improve mental well-being. Movement helps the body release endorphins, nature's feel-good chemicals. And when done outdoors, under sunlight, it helps boost vitamin D, which is often linked to mood regulation. Nutrition also matters. A well-balanced diet rich in whole grains, fresh fruits, vegetables, and omega-3 fatty acids can positively impact brain function and emotional health. Avoiding excessive sugar and processed foods can also help reduce energy crashes and irritability. Another vital piece of the puzzle is social connection. Loneliness can worsen depression, especially in older adults who may have lost close friends, a spouse, or become distanced from family. That's why re-engaging with community, whether through local senior centers, volunteer work, or even regular video calls with loved ones, can make a world of difference. Some seniors find comfort and strength through spirituality or faith. Prayer, meditation, or being part of a faith-based community may offer purpose and emotional grounding. And let's not forget the power of routine. Creating a gentle, predictable daily rhythm, wake-up time, meals, hobbies, light exercise, quiet time, can help bring back a sense of control and stability. It's also important to know that seeking help is not a sign of weakness, it's an act of courage. Depression can feel isolating, but the journey of recovery is never walked alone. There are professionals, support groups, friends, and family who care, and who want to help. If you or someone you love is facing depression in their senior years, know this: there is always hope. There is always a way forward. Healing may not happen overnight, but every step, every conversation, every kind gesture, every moment of self-care is a step toward the light. 5. The role of family and community. When it comes to depression in the elderly, support from family and community can make all the difference. As people age, their world can begin to feel smaller. Children move away, friends pass on, and the daily routines that once brought purpose may change or disappear altogether. These shifts can leave older adults feeling invisible, forgotten, or isolated. That's where the people around them, family, friends, neighbors, caregivers, play a vital role. Sometimes, just being present is the most powerful thing you can do. You don't need to be a doctor or therapist to make an impact. Small acts of connection, a phone call, a walk together, sharing a meal, can remind an elderly person that they matter, that they are seen, and that they are loved. It might seem simple, but to someone struggling with depression, these gestures can be life-changing. It's also important to listen without judgment. Older adults might not express their feelings the same way younger people do. They may speak more about physical pain than emotional distress, or they might be hesitant to open up at all. Be patient. Let them know it's okay to feel what they're feeling, and reassure them that there's no shame in needing help. If you notice signs of depression, gently encourage them to speak with a healthcare professional. Offer to help schedule an appointment or go with them if they feel nervous. Many seniors grew up in a time when mental health was not openly discussed. Your support and reassurance can help break down that stigma. In communities, programs for seniors can play a huge role in preventing and addressing depression. Senior centers, church groups, volunteer opportunities, and exercise classes are more than just social activities. They're lifelines. These spaces give older adults a reason to get out, stay active, and feel connected. Technology can also be a bridge, especially when distance is an issue. Teaching seniors how to use video calls or join online support groups can open up new ways to stay socially engaged. Connection doesn't always have to be in person, it just needs to be genuine. Finally, caregivers need support too. Whether you're a family member or a professional caregiver, watching someone you love struggle with depression can be painful and overwhelming. Don't forget to care for your own mental health as well. Support groups and resources for caregivers are available, and incredibly valuable. No one should have to face depression alone, especially not in the later years of life. When families and communities come together with compassion, patience, and understanding, healing becomes more than a possibility, it becomes a reality. Let's remember, growing older should never mean growing lonelier. Together, we can bring light back into the lives of those who once lit the way for us. Aging may bring challenges, but it should never steal hope. If you or someone you love is struggling with depression, know that help is out there, and healing is possible. Thanks for watching Health 999. If this message touched you, share it with someone who might need it. And don't forget to subscribe for more helpful, compassionate health content. You're not alone, and you never have to be.